Thank you. I'm glad to be here. I was able to get over here yesterday, and I was walking around town, and I stumbled upon this place, and I took that picture because I was thinking that's exactly what I'm doing, but they weren't open. So I wasn't able to go on a health quest, but I'm going to take you on one today. And let's see. Let's make sure. Yeah. Hopefully this works. I was walking around some more, and healthcare is everywhere these days. This is also in Amsterdam yesterday, and conveniently located next to a McDonald's. And then on my way in today, I found this picture on an ad stuck up on the tunnel on the way over. I actually went to their website, and they have a little card game that you could play. And sort of seems kind of interesting. So, health is everywhere, games are everywhere. How do we bring these two things together? And so I'm going to use the most powerful tool known to man to bring two worlds together and make them bigger, the Keynote. He did it a lot better than I will. So here's my Keynote, Super Mario Health. I want to create games that can make us all super healthier. So how many people have played Mario, like the original one? So Mario is this awesome thing, right? He has this great metaphor for what we want health to be. So what happens when Mario is like normal sized and he encounters an enemy? What happens to him if he doesn't defeat it? He dies. Not shrink, we're not there yet. But when Mario eats a mushroom, he can get bigger. And then he plows through all of his obstacles. And when he doesn't plow through them, when he meets defeat at the hands of an obstacle, what does he do? I heard it over here. He shrinks back to normal. He doesn't die. That's this notion of super health, that we can build health assets within ourselves, that we can make ourselves more than just a normal baseline health, that when we encounter a health obstacle or a crisis in our life, we don't fall apart. We sort of plow through it. We take some damage, but we don't end up below our baseline. We don't end up in a care-needing situation. So I'm going to talk about that. I always show a slide that tells you all the games I've been playing lately. I think everybody should do this when they talk about games. I want to know what you're playing. I want to learn from what you've been playing. I want to find new games, new experiences, new design patterns that I can take and use in the problem spaces that I work in. So these are the ones I'm playing. I'm playing a lot of these with my two sons, 7 and 5. So the Games for Health project, 7 years old, and we started in the United States, and we've been really big supporters of what's going on here, as well as around the world with other groups that are interested in this notion that video games can help with health and healthcare. So we've even built like models, like ideas about what we mean by games for health. And we're talking about how they can motivate us, how they can support us, and how they can sustain our engagement with learning and changing our behaviors and getting better at providing health and healthcare. And we can even elaborate on these models and sort of think about what specifically goes on within gameplay that helps us. What are the sort of micropsychology moments, the many of them that are embedded in very good, well-designed games, and how can we apply that to what we want to do? So we did some of that. We even built a taxonomy, and this taxonomy has guided our own conferences. We've used it to help inform this conference. This notion that across these 2 days, you're going to see many, many different ideas on the applications of health and healthcare, not just one particular thing. You meet somebody on the street, you say, oh, I'm working on video games and healthcare. And they're like, what is that? And they're like, oh, well, exergaming. Right? Oh, yeah. Oh, Wii Fit. Yeah. But that's like one box. There's so many more. And I'm glad to see so many of these boxes filled in here at this conference. Because I think that changes the idea that games are for a specific part of health, that games are for health, that it's a strategic, fundamental investment in our healthcare and in our society that we can make. And if we change something from being just a singular investment to something being a strategic investment, that really changes the game. We can move on. We're at this conference. I invite you all to our conference in Boston this June. You can actually find an ad for this conference on the back of the new Games for Health journal that Marianne Liebert Publishing has just started. Another sign that this field is growing and that it takes itself quite seriously to prove its results and to expand on its ideas and to take chances and communicate them to everybody. So we hope to see you there. Of course, one of the outputs of the Games for Health field, can't take sole credit for this by any means, is the fact that we actually have games, really interesting games. All these games, for whatever they may be, and I could explain them all to you, they all look kind of interesting, right? You at least want to pick that up. I love that one with the tree in the middle. It's actually a game about standing up. It's the most amazing game about just standing up out of a chair you'll ever play in your life. It comes from Japan. And then, of course, we see Elude. This was a game that was actually given birth at our Games for Health conference, where the two people who collaborated on it met each other at our conference a couple of years ago. And I know Doris Rush, the designer of this game, will be talking about this later today. So that's enough about at least what Games for Health is and what we've been doing as a project in the United States, and a little glimpse at sort of how we're trying to build and bring these concepts into focus. I don't want to talk too much about that. I want to talk a little bit more about this, which is, this is sort of my analysis of healthcare as it exists today. You know, there are not enough people who receive adequate care, whether it be on a national or a global basis, wherever you are. We pay for the care of illness and injury. That's when you engage the healthcare system, when you are ill or injured. And right now, we have this notion of wellness consumerism, you know, all these products that we can supposedly buy to make us better. And we're not actually sure many of them do that. But we buy a lot of them. There's no doubt that there's a lot of money to be made. But we're not sure whether or not it has the impact. And in fact, many times we find out that a lot of this consumerist behavior is a counterintuitive impact. The major health technologies that we use today, a lot of them drive up costs. Now, there's no doubt that things like imaging have been incredibly important to the rise of modern health and healthcare. There are people alive likely in this room because of these technologies. But when I was born in the age of technology, much like many of you, and I was always born to subscribe to the economic belief that these technologies drive down costs. But mostly we're seeing them drive up costs for a variety of reasons. Mostly because we focused on big technologies, these giant systems that are incredible, no doubt, but they're big and they're getting, as they get better, they're also getting more expensive. And they're more expensive to staff, and they're more expensive to use. And we're using them, perhaps, according to certain studies, too much. But we have this personal health IT, this sort of health 2.0 that you hear sort of amorphously talked about. And that is actually based more on the kinds of information technologies that all of us in this room understand drive down costs. So we're part of this curve. We want to be part of this curve where the mobile technologies go down in price or up in power for the same price, that Moore's law curve or that Metcalfe's law of social networks. The majority of the media that we use to affect health behavior change is old media. It's pamphlets, it's books, it's television ads, it's radio PSAs, public service announcements. These are old media in my life. My kids barely even know what a radio is. They certainly don't know what television is. They know what on-demand television is. They know they can watch any show anytime they want, devoid of commercials, which is good, right? No sugary snacks. But also bad, because there's nothing there that tells them, you know, oh, there's a tornado coming, or oh, there's a virus outbreak. There's no way to reach them. The DNA medicine, I'm going to TED-Med. I fly out tomorrow. I was there last year. And they give the amount of talks that you hear about where you're going to have your personal DNA decoded so that we can figure out which drugs and therapies might be effective just for you, that we can pull drugs that we're holding on the shelf right now because they can't test out on a population level. We're too scared to use them because they may have an adverse side effect. But now we can remove the chance of that side effect because you have this specific personal genome that we know it doesn't have that effect on. Well, that's going to change things. The ability to understand your health is going to be inexorably tied not only to this type of medicine, but to this whole notion of personalized probabilistic medicine. Most people don't understand probability, and they're supposed to understand this new system. They don't even understand the old system. So now we have this changing landscape on top of all of it, right? Television's going down, video games are going up. We've had major healthcare reform in the United States take hold. And will take hold more. We will see this in other Western economies. So that not only are things changing, they're changing really fast. Which leaves us with this, right? The current system, one giant mess. All of this new notions, one giant mess that hasn't shaken out yet. All this new policy change, one giant mess. We have a gigantic mess on our hands. So how do we start thinking about that? How do we start trying to see what our role is and sort of maybe not making this so messy? So we have to kind of rethink what we mean by health and healthcare. So we go back to the World Health Organization, which says that health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity, right? This is not the notion of what most people consider to be health. They are like, well, I'm not sick. But are you healthy? I'm not sick. That's the reply that you get. Dr. Martin Seligman, who is a well-known psychologist with some really interesting ideas and was the keynote at our Games for Health conference this summer, he and his peers have put forward this new notion of positive health, which is sort of very much in keeping with what the WHO has talked about. And he talks about that positive health describes the state beyond the mere absence of disease, and it's definable and measurable. So he's actually working with a grant from the Robert Wood Johnson Foundation to look into data sets. We have some very large data sets in the United States, as I'm sure you have here in Europe. And he's actually going back in through them and looking and seeing if we can find these evidence around notions of positive health, looking at things like heart rate variance, looking at psychological markers, and even functional markers. Do you have these skills that allow you to be healthier in general? Do you have positive outlooks? Do you have the ability to actively and constructively respond to people to make them happier around you? And what is that link between happiness and health and content and all of these things? And can we actually give you skills ahead of time? Can we give you the skills so that when you do get sick, you don't fall apart. You're able to give your self-care or provide cares to others that makes them healthier without the need or with the reduced need to engage a system that we think, in some respects, is fundamentally broken. So here, this was the analysis that I've had. I'm sure many of you share parts or all of this or even other parts. Here's the new model for health that I see emerging when I talk to people who I have a lot of interest in and sort of hear what they're trying to shape. So we're going to have this global democratized self and social care. We will take care of ourselves better, and we will take care of those around us better, including people we don't even know. And just our mere presence among them could make them healthier. The providers, the healthcare providers, be it our employers, our governments, our healthcare plans, they will pay for our wellness. They will not necessarily pay just for when we are sick or injured. So they will pay to keep us not sick. They will pay to keep us from getting sick. They'll pay to keep us from getting injured. We'll get this aligned forces between the healthcare system and this really interesting consumer system that we see, especially along social media and the types of products that we actually think can take advantage of consumer practices, consumer networks, consumer distribution and logistics, but in the right ways. And then we'll adopt these technologies. We will build these things on the technologies we know drive down costs and not just overinvest in technologies that are driving up costs, however great they may be. And we'll measure everything. We're going to get into this notion that you will constantly have your health under profile for your own self. Now, there are privacy issues and all kinds of things to be sorted out there, but you will be able to understand your actual state of health on a daily basis far better than you do now. and you will understand its trajectory, and you will understand how to change that trajectory. And ideally, all of this is wrapped in this seductive, ubiquitous, lifelong health interface. In fact, one of the big problems with healthcare in that one giant mess is that the actual interface by which we engage healthcare, whether it be the IT interfaces in hospitals, or the signage, or just the way doctors' visits work, or the jargon that gets used, or the mass advertising for products that we don't really understand, all of that ideally will go away and be replaced with the kinds of interfaces that we know and love that are symbiotic to the problems we solve. Where do you find great symbiotic problem-solving interfaces? Video games. And so we'll then get this new health literacy that will emerge from this. A health literacy that's aimed at this system and aimed at making you really, really literate amongst it, because you cannot get that first one without the last one. So what are some other ways we'll do this? Well, we think sensors will become a very big part of this. We're working with some sensor-based startups in the United States. We held our first sensor games day at Games for Health this year. We think that this notion of connected health, using both social networks, but also getting the apparatus, the disconnected apparatus of our health system and health professionals, and connecting them with the systems that we use. You know, the Wii Fit in Japan can actually send data to your doctor. Can't do that most other places, and most games don't do that at all. Most video games for health and healthcare, let alone most video games in general, are not connected to much of anything. When we get the quantified health, that notion that we can constantly be measuring ourselves, and we can also take this notion of positive health that Dr. Seligman and others like him are talking about. So what this means is that we get to you earlier. We want to engage you in a full spectrum health much, much earlier in your lifespan. We want to raise your self-efficacy about what it means to be healthy, not that it just means to not be sick. And we want to change your model of self-health, what your responsibilities are, and the systems and the needs and the ideas and the tools that we give you to leverage what motivation you have. We want to leverage your motivation because there's so much needed. We can only, if we can't leverage that motivation and expand it with the tools that we give you, it's going to be hard to, not everybody is as self-motivated as the next person. We want to build these health assets. And from that age of 10 to 40, when most people are normally healthy, and by normally healthy I mean they're not really getting sick. They're basically tuned out, unless they're a fitness person. And fitness is not necessarily the same thing as health, especially like athleticism in that sense. We want to figure out how can we engage with you? How can we prepare you so that when you get to be 40, that sort of proverbial age where supposedly your body and it starts to fall apart, right? Mine's doing it to me now. We can actually not have you first appear as a data point then, but have 40 years, 30 years of data points, and 30 years of skill building about those data points so that when you really need them, when they can be a reservoir of strength instead of negative that you don't have. And now I've got to teach you all of this stuff right then when it's almost, it could be too late. So we looked at all of that. We started thinking about new models of health and healthcare. And then we started looking at the types of games that have been made so far in the Games for Health space. And we saw sort of 3 interesting sections. So we saw games like Wii Fit, large amounts of sales, amazing, amazing sales. $1 billion at retail globally, that game. But very low health impact. Well, we saw some novel uses of it, and we saw some audience types, some psychographics that took up video game exercise that hadn't taken up. We just didn't see the numbers. Between the sales and the health coefficient, it just wasn't there. I don't necessarily want to blame Nintendo for that. So I don't mean that. I just mean it's fact. Then we saw things like Remission, really amazing game. People like Pam Cato worked on that. Really high health impact, proven evidence-based health impact for these people, but a very narrow audience. It's for kids with cancer. Nothing, I don't want any kid to have cancer, and if they do, I want them to have tools like Remission and everything else. But that's not, that's another part of what we see. And then we see a lot of the following: bad games with bad targets. So I call them nominally the catch the fruit games. There are actually games called catch the fruit. I think most people understand to catch fruit versus pizza when that's the game choice. We don't need those games. So we have to solve the delta between the sales impact and the health impact. We have to move beyond the disease state-based kinds of audiences that we're cultivating. And we have to rethink the targets by rethinking the health model. So we did all that, or at least we're trying to do all that. And we're really banging our heads against the wall to come up with something that really took into effect all of this criticism that we were gathering. I mean, looking inside the project for the last 7 years. And I finally spent one day, I had a call, and I had to come up with something, and I was just trying to find something. And I just decided, I said, what are the health games everyone should play? And when I wrote this down, it really resonated with me, because what it meant was that these are the games that you should play whether you're healthy or not healthy. That ideally, we should create games that make us super healthy. That we engage them at almost any moment in our life, and the earlier the better, and ideally under certain circumstances, the more sustained the better. And that there's no excuse not to play these, with the exception of, well, I'm doing like exercise, but I don't need a video game to do it. Fine, good. Well, we don't need to help you. So we then started building characteristics about these. They will not be disease-based. They will be consumer-facing business and distribution model, but that doesn't mean that they're packaged goods. It doesn't mean we want to enter into that consumerism version, but we do want to take advantage of what those systems represent, be it commercial or social entrepreneurial. We want to address the multiple health issues at the fundamental level. We want to make things that can be global. They can run everywhere. I mean, every country, every device, every opportunity. And we want to ideally make you healthier immediately after you even have a single play of these games. It does not mean that your little extra bit of healthiness lasts for the rest of your life, just like if you exercise. If you exercise in general, you should be somewhat healthier on a certain, even theoretical level, but it will then drop off if you don't adhere. But there are other things, like skills that we could gain, that we could gain from one play, and it will last us our lifetime. We can offer population-based health effects, everybody. And we can ideally get even effects by just embedding games in populations. And we can address this new health model. So we've been working on this for about 6 months now. And this is just a preview of where we're at. But we've identified almost about 14 or 15 different areas, either types of games or categories of games, or subject matters that we think fit this model. And we're searching for more. And we're then taking each one of these and we're defining it further. And we're bringing experts together to discuss them and to discuss video games. And by experts, I mean not just subject matter experts, I mean game developers. I mean business development from the games industry. I mean people who understand how you get lots of people to play lots of things. And then we are looking even at different strategies, right? Not everything that we're thinking about is about building a better game. Yes, we have tons of research and experts in our network who could help you build a better extra game tomorrow and raise that coefficient between sales impact and health impact just by making a better game. But we also think there are ways to build tools and systems and services that could help all games of that type. Because clearly, in some of these areas right here, we have lots of commercial activity, startup activity, and research activity. What we don't have are those things resulting in the impacts that we feel are deserved. So we would use these types of, these are a variety of cognitive games sold in Japan, but we're trying to think about what are the types of things that would create rising tides for certain product categories. Maybe that's where we should invest our time and energy, not in making the games. Now, in other areas, we might have to make the games because these games are not being made to a sufficient level. So maybe we have to figure out what they should be. What a really good game about probability could be a very important 21st century health skill. First aid is kind of interesting to me because for all of these simulation games that we've had developed, most of them focus on medical professionals. But what's the one simulation game that we could make tomorrow that would make everybody in this room potentially healthier? It would be a first aid game, much like the funny video we saw this morning, right? I mean, there's a reason I want to go talk to Harmonix and make Rock Band, in case you didn't know. So we could also do self-diagnostic games. I've been working on some designs for various types of cancer screenings to train people how to do them for themselves or how to do them for others, but ideally to make people healthier, because certain types of cancer screenings are things that are lifelong skills by the time you reach a certain age. So what do we talk about with population health effects? Well, this is what I want to do. I want to take a population of people. I want to inject games into that population, games of all kinds of different types on all kinds of different consumer platforms. I want to make these things ubiquitous, using the systems that traditional, great, and successful video games do. And then I want to take my different game ideas and I'm going to sprinkle them throughout the population. I'm going to find a way to crack this problem by both having better targets and better games. And then as a result, not only are certain people themselves who play the game super healthy, the people around them benefit as well. The person who knows first aid makes the people around them who are within the space-time distance from them healthier. Because if that person does not exist for them and the person who does have that skill is too far away, they will not get the help they need. The person who has practiced better safe sex procedures not only makes themselves healthier, they make everybody they have sex with healthier. We can also look at this other way. We can flip this whole notion on its head. We can look at gamers themselves as a mass market population. And we can think about, if we're going to make games healthier, or if we're going to make healthier games, can we make the mass market games and the gamers within that mass market be healthier? I think we can. And we've actually looked at some ideas about this. We've actually worked with Ben Heckendorn, aka Ben Heck, who mods game hardware, and we've looked at ways to modify game hardware so that that hardware allows two people to play games together of varying skills. So now parents can play with their kids, people can play with people with disabilities, their favorite games. We can even swap out one of the joysticks and put in a gamepad. Now we can make every game an extra game. But more importantly, we get more people playing together. We can even look at the types of things that gamers do and advise them about their health and healthcare. Not only as it reflects on the games they play, but just making them better people. Encouraging parents to actually play the games. Stop worrying about whether they're violent or not violent. You're not doing anything. You're not interacting with your kids. You're in the other room. That's not healthy. It doesn't matter whether they're playing a Disney game or Call of Duty. You're both being unhealthy. So we're looking at that as well. So we think we can make Super Mario Health. So there's Mario. By the way, I picked Super Metroid for the female. Not many people know that, but she's a female. Games, so this is what I mean, is that Super Mario Health is personal and public health. The Robert Wood Johnson Foundation, which funds the Games for Health project in the United States, is the largest health philanthropy focused on the health of all Americans. And it's a public health-oriented organization. And so we've been on a major health quest to figure out how games improve public health. And we had bits and pieces of the puzzle along the way, thanks to many of you in this room. But I think with what we've done here is we're starting to put together something that seems like a strategic plan, a way to have real strategic investment in what we do, how we do it, and why. And that's what I was hoping to bring to you today. I think games are the socio-physio-cognitive media-based fabric of a new public health model and infrastructure. And I'm hoping that you can help me build it. Thank you.